Hello everybody, thank you for joining us and viewing this resource, which is intended to support practitioners like yourselves using the Adult Safeguarding portal here in Walsall, and more specifically to help multi-agency practitioners know when to submit a safeguarding referral and to ensure that it's of good quality. We all recognise the importance of submitting good quality referrals that contain all of the necessary information so that we get positive and timely outcomes for adults at risk of abuse and neglect. This resource will sit on the Walsall Safeguarding Partnership Adults section of the website, and we encourage you to share it across your teams and to refer to it when you are required to submit a safeguarding referral. You'll notice that the resource is also time-stamped so that helpfully you can go straight back to the sections that you wish to revisit after you've watched it. My name's Sian Jones. I'm head of the Safeguarding Partnership here in Walsall, and I will introduce my colleagues shortly. I just want to cover the aims and objectives of the session so that you know what to expect. We hope that this resource will support staff when raising a safeguarding concern. We're going to share some advice and useful resources about what makes good quality referrals and supports you to consider the information that's required when you are raising safeguarding concerns, how and when to do that, and which key services that you may need to contact. We're focusing specifically today on the professional portal on the website, but we do want to highlight that there is now a citizens portal that you may want to raise awareness of across the communities that you're working in, and that's there for any local community members to raise safeguarding concerns should they see anything that worries them or have concerns about their neighbours. So before we begin, let's just start with some introductions, because as I said, we're joined by some colleagues from the Safeguarding Partnership here in Walsall today. Mark, can I come to you first?
Hello all, I'm Sergeant Mark Lamb and I oversee the exploitation team based at the Walsall Civic.
Thanks, Mark. Michelle?
Hi, I'm Michelle Alston. I'm the Adult Safeguarding Lead for Walsall Council.
Thanks, Michelle. Claire?
Hi, I'm Claire Temporal. I'm the Project Manager at Change, Grow, Live, the Beacon in Walsall Substance Misuse Service.
Thanks, Claire. Rachel?
Hiya, my name's Rachel Dale. I'm the lead nurse for safeguarding adults at Walsall Healthcare Trust.
Thank you, Rachel. And Chloe.
Hi everyone, I'm Chloe Jones. I'm the Programme Development Lead for the Walsall Safeguarding Partnership.
Thanks everybody, and thanks for joining us today to help us produce this resource. So we're going to move on now to consider, what does safeguarding adults mean? All organisations, as I'm sure you're aware, have a duty to ensure that the welfare of all adults is maintained. And to do this effectively, professionals need to know what safeguarding adults actually means and when to follow your own single agency and multi-agency safeguarding adult procedures. As you probably already know, there's been a move away from terminology of a vulnerable adult in recent years towards adults at risk of harm. The Care Act 2014 makes it clear that abuse of adults links to circumstances rather than characteristics of people experiencing the harm, and labelling groups of people as inherently vulnerable was seen to be disempowering. So we're going to consider what it actually means in practice today as we move through this resource. The Care Act 2014 sets out clear legal frameworks for how local authorities and other statutory agencies, many of which are on this call today, should work together to protect adults with care and support needs who are at risk of abuse and neglect. So Michelle, can I come to you to talk us through this framework in a little more detail?
Of course, safeguarding is protecting an adult's right to live in safety, free from abuse or neglect. It's about people and organisations working together to prevent and stop both the risks and experience of abuse or neglect, while at the same time making sure that the adult's well-being is promoted. This means listening to their views, wishes and feelings. There is a focus on empowerment, prevention, proportionality, protection, accountability and most importantly, partnership. This helps to ensure people's rights are respected, risks are managed and help is collaborative, proportionate and transparent. The Care Act defines care support needs as the difficulties a person might face in achieving and maintaining independence. This can include things like managing their personal hygiene, developing relationships, or maintaining a habitual home. These needs can often stem from disability or long-term illness.
Thanks, Michelle. That's really helpful. So now we know what safeguarding adults means, let's take a look specifically at when a safeguarding referral should be raised. Here in Walsall, we've been using this decision-making flowchart, and practitioners tell us that it's really helpful in walking them through the things to consider before submitting a referral. So in this resource, we're going to spend some time looking at each key section, and we'd encourage all partner agencies to share this widely across your own organisations. It could be useful to include in single agency training, for instance, or carrying it with you as a practical resource when you're going out on home visits, for example. So in using the flowchart, you'll see that you start at the top and that each key question is in a box. As you move down the flowchart, where you reach a no, you are simply exiting the safeguarding pathway, but it remains important to ensure that appropriate prevention services and signposting has taken place. So let's consider now what that looks like to different organisations when they be using the flowchart to support their work. Claire, can I come to you to talk to us about how you might use it in your service?
So for my service, we keep it in a folder on our shared drive so that our frontline staff can use it for guidance whenever they have a safeguarding concern.
Thanks, Claire. And Rachel?
Yeah, so we have staff who work in the acute trust and in the community as well. So for our community staff, it could be a tool that they perhaps keep in their car, so it's handy to refer to.
Thank you. Mark?
So in the police, we need the information to be submitted to us through a police information report, PIR, which was previously known as a Force Intelligence Bureau report, a FIB form, as most people knew it as. This will allow them to raise specific concerns to us, the police, alongside raising the safeguard referral. This PIR can be used to highlight any concern that is raised along with the professional. That could be individual circumstances, associations, or behaviour patterns. We can then use that to provide the most appropriate response to the needs in question.
Thanks, Mark. So yeah, that's a really important point, that you can share intelligence with the police through that PIR form, as well as considering this flowchart wider in terms of your safeguarding referral activity as well. So some really good examples about how you might use this flowchart within your service. And again, thinking about it in a wider sense, it's also probably a really helpful quality assurance tool. Maybe if you're a manager in an organisation and you're giving feedback around referrals and the quality of them, perhaps you could use the flowchart with members of staff to talk them through. I think another really important point when we're thinking about management and advice from single agencies is to always ensure that you utilise your own safeguarding teams where they exist within organisations, that you've had that conversation with them prior to submitting any referrals. And again, taking in this flowchart and focusing your conversation around that is probably a really helpful way of structuring the discussions. So let's move to step one. So the first thing that we need to consider when we're concerned about an adult is whether that person's at immediate risk and do they require any medical attention. Mark, so could you give us some examples of situations that practitioners might need to contact the police?
So there are examples such as if there's an immediate danger to life or threat to property, if somebody's using violence or threatening the use of violence, or if there is a crime occurring right then and there, such as a burglary, a theft, an assault type incident, then that would be quite appropriate to call 999 immediately and request police support. If it's a non-emergency situation, say you're engaging with a member of the public and they give you some information about something that's recently happened, like yesterday, that wouldn't require the same emergency response. So that would be more appropriately through the 101 call to police to report the matter at hand.
Thanks, Mark. And Rachel, what about an emergency from a health perspective?
Yeah, so there might be times when actually the priority is perhaps you've got someone bleeding or someone's unconscious or visibly really quite injured. In that situation, it would also be a priority to be thinking about calling an ambulance on 999 as well.
Thanks, Rachel. And I imagine that extends to presentations around concerns for somebody's mental health. If it's quite acute and severe, that would be an emergency health response first and foremost.
Yeah, absolutely. So the ambulance service are trained to help those who are having what could be deemed as a mental health crisis. So they would be able to support with that as well. There might be situations where you might need the police as well as the ambulance service. So just to consider that really as well, depending on the situation. And I think doing that mini dynamic risk assessment as to what you think the priority is, which is something as practitioners we do quite a lot, those mini dynamic risk assessments.
Thanks, Rachel. Michelle, I just want to bring you in on that point where there might be examples where, as Rachel's just said, we're calling on emergency services and we still have concerns around safeguarding the adult as well. Is there anything that you'd want to add about that?
I think you still need to refer into safeguarding if you think it's a safeguarding matter. Don't be reliant on other professionals doing that for you. We are not worried if we get duplicate referrals. We're well able to manage those, and we'd rather hear about a safeguarding 3 or 4 times than not hear about it at all.
Thanks, Michelle. Yeah, really important point that we mustn't assume that somebody else is going to make that referral on our behalf, even if we have had to call on emergency services, as has just been described. So in this resource, we've just popped some of that key contact information there on a slide for you, so you can refer back to it that our colleagues have just spoken about. Again, you'll see there that we've put the link for the professionals portal. That is the adult safeguarding referral form that we're here to talk about today. And we've got the link there for the citizen portal, again, should you wish to promote that across your local communities. And all of the references, as Mark and Rachel have just spoken about, are in there too. So moving on to step 2. As we've already highlighted, under the Care Act, safeguarding is when somebody has care and support needs and is experiencing or at risk of experiencing abuse or neglect, and that they're unable to protect themselves. So in this section, we're going to talk about determining whether a person has care and support needs. And Michelle, can I come to you just to talk us through what a care and support need might look like?
Well, care and support needs are the help an adult needs to live as well as possible with any illness or disability they may have. It is a broad term that covers many different situations, including physical, mental, or sensory impairments, substance misuse, and learning or cognitive disabilities. Care can look like practical, emotional, or financial support, and an adult may be receiving formal care, have an informal carer, or have no support in place at all.
Thanks, Michelle. Claire, I wonder if you could just highlight what professionals could do if an adult doesn't appear to have care and support needs.
So if an adult does not appear to have care and support needs, professionals should still offer information, advice and support. They should also consider other organisations or people that may be able to help.
Thanks, Claire. And as I've said, there are a lot of resources on the Safeguarding Adult Board website, which includes information to signpost to other services that exist around Walsall that could support those adults. So moving on to step 3, we're going to consider now whether the adult is experiencing or at risk of experiencing abuse or neglect. It's important to remember that it's not the fact that the adult has care and support needs, but whether they're actually experiencing or at risk of experiencing abuse and whether they're in a position to protect themselves from that abuse. So Michelle, can I come to you and ask how you think professionals can best understand what abuse is?
Yes, well, the Care Act defines 10 categories of abuse that you can see here on the screen. There are also 4 additional types of harm that are not included in the Care Act, but which we find are also relevant to safeguarding adults: cyberbullying, forced marriage, mate crime, and radicalisation. Abuse can often be recognised as misuse of power within a relationship. Depending on the abuse, there can be changes that the professional observes, like bruises or untreated injuries, changes in a person's behaviour or appearance, or changes in their finances.
So Michelle, if professionals aren't sure how to categorise what they're seeing, is there anywhere that they can look for additional help and support?
Yes, the West Midlands Policy and Procedures for Protection of Adults with Care and Support Needs provides a comprehensive list of the abuse category definitions. When professionals use a portal to refer, they can also hover over the abuse categories to see the definitions too. It's helpful for professionals to pause and take time to consider whether what they are seeing appears to be abuse or neglect or risk of abuse or neglect.
Thanks, Michelle. That's good to know. What can professionals do if they're worried about someone, but they can't identify abuse or neglect occurring?
When professionals are worried, they can refer through to adult social care or partner agencies in the normal ways. They can also speak to their internal safeguarding leads for advice and guidance. Concerns that don't involve abuse or neglect shouldn't be referred as safeguarding.
Thanks, Michelle. Yeah, that's an important point for us to keep remembering, that where those safeguarding teams exist within single agencies, that's where those conversations should be happening, and additional advice and support can be offered. So moving on to step 4, once we've determined that the person has the appearance of care and support needs and is at risk of experiencing abuse or neglect, what do we need to think about next?
So next, we need to think about whether the person's care and support needs impact on their ability to protect themselves from that abuse or neglect. It's important to consider these questions in order, as it's a culmination of these factors that help us understand whether to refer to safeguarding or not. We can help people to protect themselves by having open conversations about why we are worried. By talking to people, we give them a chance to tell us whether they feel safe and what they're doing to protect themselves. Every person is individual and all circumstances are personal to them. If a person can protect themselves from the identified abuse or neglect, we can offer support, advice, information and signposting.
Thank you, Claire. That's really helpful and leads us into some of the questions that are there in step 5 of the flowchart. These ask us to consider all of the following before raising a safeguarding concern, and we've already covered what types of abuse and neglect it is that you're concerned about. But let's just spend some time focusing on, have you had a conversation with the adult about the concerns, and have you sought the views and wishes of the adult? Because that's really important in trying to identify, as you've just said, Claire, whether or not they have that ability and capacity to protect themselves. Mark, can I come to you to think about what this might look like from a police perspective when you're seeking consent from an adult?
Yeah, so police will require consent from the individual to progress support referral processes. So if the individual has capacity, please ensure that you gain that consent. So also, please consider that any person can report an incident as a third party. That will enable us to then begin our police engagement with the individual in question to progress either a criminal or a non-crime investigation, but that still needs to happen with their consent. There are certain types of investigations that we can progress without the victim engaging with us, but that needs to be undertaken on a case-by-case basis.
Thank you, Mark. And there may be circumstances where the safety of the person or yourself as a member of staff prevents those conversations from happening. So Claire, can I come to you to talk to us a little bit about what professionals should do if they've still got concerns about abuse or neglect and it's not been possible or even within their scope, the scope of their role, to have that conversation with the adult or have gained consent from them?
So we should always look to speak to the adult where it is safe to do so, but of course there may be times where this isn't possible, and so professionals should think about the presenting risks and whether, from the information available to them, that there is abuse or neglect likely to be occurring and whether the adult can protect themselves. If in doubt, raise a safeguarding concern.
Thanks, Claire. And I can see how the flowchart helps professionals to think through their concerns.
Yeah, this is a good time for professionals to pause and reflect on their previous answers. It provides an opportunity to think about what they can do immediately to ensure the person's safety and well-being. This could be providing advice or information or referring them through to other agencies for support.
So it's really important to make sure that you've spoken to the person themselves and let them know why you're worried. Referrals to safeguarding should be made with the consent of the adult, so they should know all about the process and what your worries are, where this can be safely obtained. All decisions should be proportionately and appropriately recorded in your internal agency files to demonstrate why you've decided to refer or not. So just make sure you're documenting everything, really.
Thanks, Rachel. Yeah, really important point about detailed records. So, Michelle, we've heard from Mark about seeking consent from a police perspective and some of the activity that would follow. But when should professionals consider referring without consent to adult social care?
Well, there is very specific circumstances where a professional should override the expressed wishes and feelings of the adult. And these are when the person doesn't have capacity to make the decision and the decision is made to refer in that person's best interest, where there is a significant risk to others, and where there is a public interest. And going back to what Rachel said, you've really got to record your reasoning for overriding somebody's consent.
So I guess then a good way to look at this is to still refer where there's risk to other people. So this can include where the potential source of risk is a care provider, and so others might also be at risk of harm.
Thanks, everybody. That's really helpful walkthrough of how to use the flowchart and to consider the questions that it poses in detail. As I said, the resource is available on the Safeguarding Partnership website, and you will see there's links to resources below this recording. So once we've used the flowchart to help us determine a safeguarding referral should be made, we need to submit those concerns on the Adult Safeguarding portal. And the short video that follows now will show you how to access that, where to find it on our website. Okay, so we've discussed how to use the flowchart and some of the things that you might want to think about in terms of gathering the intelligence to submit around your concerns and who to speak to as part of that process. Now I want to spend a little bit of time looking at what does a good quality referral look like and why is it important? And to do that, we're going to think about what information you need to have available when making a referral. Michelle, can I come to you?
Yeah. Before starting the referral, make sure that you have key information to hand, like the person's date of birth, address, NHS number. You will need to include who you are worried about, what has happened to them, when and how. You'll also be asked about the adult's capacity and what they think about you raising the concern.
It's really important that you make sure that your referral is clear and factual, and you should think about the language you use. I know particularly in health we have a tendency to use abbreviations, and what might mean something in health might mean something else in, for example, social care. So it's avoiding any medical terminology, abbreviations and jargon, so it's really clear.
So after you've submitted the referral, it's really positive that the portal allows you to save a copy to download and store for your own records, and this can be in line with your own agency's procedures. And it will also allow for information to be fed back to you. And that's why it's so important to use the correct contact details.
Thanks, everybody. So some important points there that have been highlighted. Firstly, about the use of language and avoiding jargon and terminology, really helpful to explain in referrals what the impact of what you're seeing or an adult is experiencing is having on them. And as Claire has said, really important that you include your own work details, not personal details, in the referral forms when you're completing them. And then that way, all of the information and what happens next gets sent directly back to you. So once those safeguarding referrals have been submitted, let's talk now about what happens next once you've submitted that safeguarding referral. And Michelle, can I come to you?
Well, once the concern is submitted on the portal, it comes straight through to Adult Social Care. Our staff in the Safeguarding Hub review concerns during office hours, and they're reviewed within 2 days of receipt. They'll speak to the person about the concerns, which is why it's important professionals have already told them they are going to refer to Adult Social Care. The Safeguarding Hub has 5 working days to seek and share information with other agencies to reach a decision on whether the statutory threshold for safeguarding has been met. A safeguarding inquiry can then take place.
Thanks, Michelle. So how do referrers hear about the outcomes of the referrals?
An outcome is sent to the person who submitted the safeguarding concern. That's why it's really important professionals make sure they put the right details on the referral. When outcomes are shared, we think about proportionality and only share what is appropriate. The outcome will therefore tell you whether we have progressed to inquiry or not.
Thank you. And if the concern does progress to an inquiry, what does that look like?
Well, a social worker will be allocated to complete the inquiry. They will speak to the person about what their wishes and feelings are so they can work with them to achieve them. Being safe can look different to different people, and so it's really important that the person is central to our work. Adult Social Care will work with all relevant professionals involved in the person's life. These may be statutory and non-statutory organisations with short and long-term involvement. Often we'll convene a safeguarding meeting with the person, their representatives and the professionals involved in their life to talk about the outcomes of the inquiry and the next steps.
Thank you, Michelle. Thanks everybody for your contributions. So let's just do a really quick summary. Hopefully you found this resource helpful. We've highlighted when safeguarding concerns should be submitted and how to do that via the portal. It's important to note that they are only looked at during office hours, so please refer back to those key contacts that we've shared, and if you are worried about someone outside of the usual office hours, then contact the emergency duty team on the numbers that we've provided. And again, as a reminder from our colleagues in police and health, call 999 for an emergency response when there is a risk to life or a threat to life under some of the circumstances and examples that we've shared earlier in this session. But don't worry about also submitting that safeguarding referral. As Michelle said earlier, it is better that a referral comes in 3 times than not at all for an adult. And we all have a statutory duty to ensure that we're protecting adults at risk. So we hope you found that this resource helpful and it's met the key objectives of raising awareness about what good quality referrals look like, where to find the resources that can support you in considering whether you are got concerns about an adult and whether there needs to be some activity to safeguard them. And also not to forget that that citizen portal is there and that we ask that you share that out to your local communities. But for professionals, please do only use the professional portal to submit your concerns. Finally, there are resources available to support this short video and you'll find those below. Thank you everybody for your time.